has honestly been a fun time in clinical. Hey everyone, my name is Kristen and welcome to my YouTube channel. I'm currently in my 4th and final semester of nursing school, and on my channel I talk about all things nursing. So if you're interested in that kind of content, just go ahead and hit that subscribe button down below. And today I really just wanted to talk about my Med-Surg 2 clinical and how it compares and contrasts to my Med-Surg 1 clinical. So if you are interested in knowing what I do in clinical, just go ahead and keep watching. Out a new background today. I can already tell you I don't like the area I'm filming in, but I'm just gonna go ahead and film the video anyway, and then next week you might see me in a new place. How I'm gonna lay this video out is I'm just gonna describe my Med-Surg 1 clinical, my Med-Surg 2 clinical, and then kind of tell you where these similarities might lie. Now, my Med-Surg 1 clinical was an 8-hour clinical. I arrived on the unit by 6:50 in the morning. Now, my Med-Surg 1 clinical, I was on a regular gen med floor. The patients varied in ages, the patients had all different kind of health conditions, and honestly, this was my first clinical, so I had no idea what I was doing, and I was very nervous, probably most of all my Med-Surg clinicals at the beginning. Really, what the day entailed was I got there by 6:50, I was given a patient assignment, I went and I listened to the SBAR, or otherwise known as report, where the night shift nurse tells the day shift nurse what happened on the previous shift and what their recommendations are for further care. Now, I would always have my report sheet, which is also known as a nurse brain sheet, and I would write down everything I needed to know about my patient in report. Now, during report, I always make sure I have my clipboard with me, and I have a report sheet for each patient that I am assigned to. I love this report sheet because it is broken up by system, so I can go ahead and write down my head to toe and keep it organized. And also, it has an hourly sheet on the side, so I can go ahead and write down what medications I need to administer at what time, so it really just helps me stay organized. And I feel like when I get out into the work world, I'll probably have something a little bit smaller than this, but for clinical, just trying to learn and then having to take this material and create a concept map out of it, it is super helpful. And if you are in the search of a good report sheet, I highly recommend this one. If you just joined the Facebook group that I created for nursing school support, I actually posted this file in there. I found this off of Google, and it has been my favorite report sheet so far. Then I would use that time after report to research my patient. Now, I would try sometimes to research my patient beforehand, but if I didn't arrive early enough, I had to wait till after report. I'm not gonna lie, Med-Surg 1, I feel like I did follow my nurse around almost the whole entire day. So I was assigned one patient, but I followed the nurse because I wanted to expose myself to other types of health conditions and different types of care that was being provided. So I really tried to do as much as I could, but I still had that one patient that I was providing care for and documenting on. The hospital that I was at for Med-Surg 1 did let us chart, so I did have to chart a full head to toe and hourly rounding too. So trying to keep up with all of that, especially the first day and even the first couple weeks, did take a minute to get used to, but I did get comfortable with it. Like I said, I had to do morning vitals and hourly rounding. So morning vitals was around 8 a.m. and normally I did the vitals and the head to toe assessment all together with my nurse in the room so they could watch me do a head to toe, as well as my clinical instructor if she ever dropped in. And then we would also do morning meds. So the morning was a very busy morning. But after that, I really just did hourly rounding. For the rest of the day, I really just followed my nurse, and then I did whatever I could do within the limits or scope of practice of a nursing student. My Med-Surg 2 clinical is a little bit different. I am on a general surgical floor. So a lot of these patients are just getting out of surgery, coming out of the OR. Sometimes they get transferred from the ER. I feel like I've seen a lot more on this floor when it comes to neuro patients, and I'll get a little bit more into that in a minute. My current clinical is a 12-hour shift, not an 8-hour shift, and I probably should say in there that I do have a little bit of a pre and post conference, and really the post conferences every semester for all my clinicals have just been, hey, how was your day? What did you learn? Tell me about your patient. And that's pretty much it. There's not much to post-conference. When it comes to my Med-Surg 2 clinical, I am assigned 2 to 3 patients, and I am still at a hospital where I am able to chart. So I have to chart on all of these patients during my hourly rounding. You know, being a nursing student, this is such great exposure, and you know, the students kind of asked for this too. We told our clinical instructors we want a little bit more independence and we want a little bit more responsibility, because this is going to be me in the next few months. Come summer, I'm going to be doing this job. I need a little bit more responsibility than just working with one patient. Yeah, I do have a lot of responsibility when it comes to med-surg too. I still have to get to the unit by 7. My clinical is from 7 to 7. I'm normally assigned that patient right before report at 7, and then once again I do that change of shift report, and I follow the nurse around during the change of shift, and after that I try my best to go and research my patients quickly. Now, normally I don't have a lot of time because the nurses on this unit get right to it. We pick our first patient and go straight to that room. Once again, I feel like this clinical, I am still following my nurse around, but I do have a little bit more freedom and independence to be able to go in the room and check on that patient without the nurse. I can do my head to toe assessment without the nurse. The nurse still will do their assessment either before or after me, but normally I don't need to have the nurse in the room to be able to perform that anymore. That's super nice. I feel like the nurses do trust the nursing students in that sense when it comes to assessment and taking vital signs. I still do morning meds around 8 o'clock. Normally we have to delegate and decide which patient is going to be our first priority, which was the same as Med-Surg 1. I still do that hourly rounding, and like I said, I still do that hourly charting. Now, I did write out a list of some of the differences that I've noticed between my Med-Surg 1 and 2 clinical. Just some main differences within the skills that I've noticed. In both my Med-Surg 1 and 2, I have been able to do wound dressings. I've been able to do Foleys. I was just never presented the opportunity to do a Foley in my Med-Surg 1. I did get to remove a Foley in my Med-Surg 2 though. So my goal is to just insert a Foley at some point. Hopefully, we'll see. I have been able to do trach care, administer medications in the pill form, IM, and some IVs. It really just depends on the clinical. Like, I know Med-Surg 2, they're more willing and open for students to do IV medications. Some other skills that I could think of that I actually can do in Med-Surg 2 that I wasn't able to do in Med-Surg 1 is IVs and blood draws. It has honestly been a fun time in clinical. In my Med-Surg 2 clinical, a lot of patients are actually Q8 vital signs instead of Q4. So in my Med-Surg 1, I was taking vitals every 4 hours. In Med-Surg 2, I'm taking vitals only once a shift. Obviously, it is a patient-to-patient basis, but this is really my normal everyday routine now. I'm really just taking vitals once a shift, unless the patient has indicated that they need vitals more frequently. Now, another difference is I actually get to do blood draws, IVs, and I get to use the IV pumps. So when I first started Med-Surg 1, the hospital that I was at was changing out IV pumps slowly into my peds rotation. So I have not been able to use the pumps at all because they had to train all the nurses first, and then they had to train the clinical instructors, and now that our clinical instructors are slowly being trained, we are actually learning how to use the pumps now. So I get to do more medication administration through the IVs and through the pumps, which is super exciting. Now I understand IVs, and when it comes to setting them up, you know, like your primary and secondary tubings, this is something that I feel like took forever for me to learn because I was not able to use the pumps, and until I do something, I'm not gonna learn it. Another difference that I noticed, like I said, I am on a gen surg floor, so I see a ton of incisions, drains, wound vacs. I see a ton of just lines coming out of the patient. This was not something that I saw on the general Med-Surg floor. Now, most of my patients in Med-Surg, like I said, were stable. They didn't have too many things we had to monitor except for Foleys and really just making sure we were giving their medication on time. When it comes to my Med-Surg 2 clinical, there is a lot of measuring I's and O's and measuring any drainage that comes out of the drains. I'm monitoring patients who are at more risk for safety, like developing pressure ulcers, and even just patients that are more of a fall risk. That was not something that I really had to deal with back in Med-Surg 1, just because a lot of these patients are coming out of surgery, so they have just gotten off of anesthesia and are currently on pain medications like opioids to help with pain that they are dealing with. I feel like on this general surgical floor, you do have to be a little bit more attentive to these things, which is something I'm still getting used to. So sometimes it does slip my mind whenever I do need to make sure that I am keeping up with monitoring all the I's and O's. That is just something that I wanted to point out because it is super important to make sure you are monitoring everything you need to every hour on the hour. And what has helped me is I actually wrote out a little cheat sheet on my clipboard for clinical of what I need to chart when. So that's very helpful so I do not forget, because I can be so forgetful sometimes. Now in both of my clinicals, I've been able to give injections like heparin injections, insulin injections. I have not been able to do blood sugar readings like AccuChecks at either of my clinicals, and that is just hospital policy. My Med-Surg 2 clinical, I've just done more injections than I have in any other clinical setting. And I've now been able to just experience more IVs, and I've been able to experience more blood draws. I recently got to do a blood draw out of a PICC line, so that was another skill I got to check off my list, which in my Med-Surg 1 clinical, I do not recall actually ever seeing a PICC line. I wanted to add in. Now it really just depends on the clinical, but I feel like my clinical instructors have definitely differed between clinicals. The reason why I say this is because they both have different personalities. They are both different. My Med-Surg 1 clinical knew that we were brand new, wanted to follow us around every day, making sure that we were okay. She would check up on us multiple times a day. As my clinicals went on, I could tell the clinical instructors believed in their nursing students and felt as though we were able to be a little bit more independent. So my clinical instructor does not come with me to administer meds, although I think she's supposed to. I'm not sure, but my floor isn't very strict about that. I can give meds with my nurses as long as the nurse is watching me. And my clinical instructor comes to check up on me like once or twice throughout the day, but if I need anything, I know exactly where she sits, so I can go straight up to her and ask her for help or ask her any questions that I have. So that's just something too. I don't know if y'all have noticed that throughout your clinicals, but I don't feel as though my clinical instructors ask me a bunch of questions anymore like they did at the beginning. So I definitely feel like it is a growth process, and I can see that I am growing into becoming a more independent nursing student. On this specific general surgical floor, I definitely have seen more neuro patients, like I mentioned earlier, and more GI patients who have undergone some sort of surgery. So like I mentioned, I've seen tons of incisions, and with the GI patients, I've seen an enema and a suppository being given. Being in my Med-Surg 2 clinical, while yes, I am on the floor for 12 hours, which is 4 more hours than my Med-Surg 1 clinical, I really do feel like the patient population is just completely different. So I am getting to know different skills that I wouldn't have learned otherwise in Med-Surg 2. Although my clinicals definitely have similarities, and I'm now in the groove of knowing what to expect, every clinical has its own uniqueness, and I'm so grateful for this clinical this semester, and I'm super excited for my CRT rotation. One last thing I want to mention that has been universal throughout all my clinicals is just making sure that as a nursing student, you are attentive to your patient, you show them empathy, and just be that active listener that they need, and go above and beyond when you can and provide hygiene care, make sure that they have clean sheets, make sure that they have fresh water. Ask them if they need anything, and really just listen to your patient. I feel like that has been universal throughout all my clinicals. And since we have the time as nursing students, try your best not to overlook all those little details, because like I always say, if my parents or any of my family members were in the hospital, I would want somebody to go above and beyond for them. So try to be that person for your patients, because that is what I try to do while I'm in clinical. Even though clinical is a crazy day, I definitely try to do what I can while I'm there. So in all, that is pretty much the similarities and differences in both of my clinicals. I kind of really summarized in one day what my clinical would really look like, and just to give you an idea of maybe what the differences in your clinical will look like, or even if you're assigned to a similar floor that I was assigned to, this just gives you a little insight on what to expect. So I hope you liked the video. Of course, give the video a thumbs up and subscribe, join the Facebook group, and I just want to wish you luck on your nursing journey.